All right, well, Palm Beach Gardens Medical Center is raising awareness on an innovative solution for many suffering from painful arthritis of the knee or hip. And joining us now to talk about a technology that's really leading the way in advanced robotic-assisted surgery is Dr. Robert Avino. He's an orthopedic surgeon at Palm Beach Gardens Medical Center. And thank you so much for joining us today. Tell us a little bit about this MAKO robotic device they use.
Well, it's a robot for hip and knee replacement surgery. It helps us be more precise in the operating room, which translates to less pain for patients, quicker recoveries, and really a more longer-lasting joint replacement that's more natural for patients.
So how does it work?
So patients get a CAT scan before surgery, and with the CAT scan, we create a 3D model of their anatomy. After that, in surgery, we marry the 3D model to the patient's anatomy, and even before I step foot in the OR, I get to plan the surgery, place the components where they need to be, and again, that's what allows us to be much more accurate. In surgery, I use a robotic arm, and with the assistance of the robot, that's what helps us position the components.
And how is it so precise, if you want to go to details on that?
Well, with the CAT scan, we can actually move the components in space, and then in surgery, we can feel the tissue tension of the patient's actual ligaments and tendons, and that's what makes it much more precise. And when we bring in the robotic arm, it lets us make very, very precise bony resections, and that's what gives the more naturally feeling knee or hip for the patient.
Do you feel that more surgeons should use something like this?
Well, I'm very fortunate to have trained at the University of Chicago and at the Cleveland Clinic, Florida here, where we really learned from world leaders in this technology. So this is really the technology that I use throughout my training, and so it's very easy to adopt. So I think that there is a learning curve for surgeons, and it's going to take some time, but I think over the long term, more surgeons are going to want to use this for their patients because it's really going to help patients with their outcomes.
And we're looking at the video of how it works. You know, it's important to understand that the surgery is performed by you, right? But you guide the robotic arm. What's the recovery like?
Most patients stay 1 day in the hospital, and many patients actually go home same day. With the anterior approach hip replacement surgery, lots of patients only take Tylenol and an anti-inflammatory for pain, so they're not really taking any of those painkillers. They're walking with a walker for the first week and then using a cane for a couple days after that, and really off those assistance devices pretty quickly after surgery.
This technology is really leading the way as far as surgeries, especially for something like this. Well, Dr. Robert Avino, thank you so much for joining us today to talk about